Vidal here at Pure Plastic Surgery. Thank you so much for logging in again. This is our weekly chat discussing different topics in plastic surgery and answering your questions. Today we are live in YouTube and Instagram, so welcoming questions from both sides. Today we're going to be talking about a special topic, a topic that we talk a lot, especially in our pre-op and our post-ops. Trust the process. And it gets a little bit redundant, and some patients get a little bit discouraged also, impatience, and all of that combined because it takes time. And sometimes people believe or think that we're just saying that to buy time. So I wanted to explain a little bit about what do we mean when we say trust the process. So why do we say this? Why does it take time? And I'll show a little bit, a few pictures, before and after pictures, to show you that process. It is something that we need to wait to see a final result. Surgery, it's not immediate. Our body's going to go through a lot of changes, and to see that final result takes time. Okay, so there are a few components: healing, swelling, skin retraction, the main three components that are going to take effect and also change your healing time and your final result. So let's start with healing. Healing, it's part of our body's response to any trauma. And surgery, it is trauma. It's an incision, it's liposuction, whatever it is, it's trauma to a tissue. When our bodies undergo trauma, there's an inflammatory cascade. What does that mean? A bunch of cells, a bunch of proteins in our body get activated, and what most of them do, especially in those initial hours after the injury, is increase inflammation, increase swelling. Okay, so that healing needs to take part so we see the final result. Okay, and you can see in this little graph here, one means the healing rate, so how much of the healing takes place, and you can see the first few days, especially 6 weeks. So this time frame is days post-surgery, and this is 1 month out. This is 6 weeks, and you can see that the healing rate is higher there. So that's why most of the restrictions and most of the things that we ask you to wait is because on those 6 weeks is the majority of the healing taking place. After those 6 weeks, you see that the healing rate, so the amount of healing that your body's doing, it decreases significantly up to a year after, 6 months, a year after surgery. Okay, so why is not a good idea to be comparing yourself to other people? It's not a good idea because everybody's body is different. Everybody reacts differently. So you can like put into comparison just twisting your ankle. Some people twist their ankle in a few days, they're fine. Some people end up with swelling in their ankle for months. And with surgery, it's the same thing. It's trauma to your body reacts differently. So there are some people that in 2-3 weeks the swelling is significantly better, the healing is significantly higher, and they in 4 to 6 weeks, they see most of the final result. And there are people that at 6 weeks are still very swollen. It's very, very far off from their final result. Okay, so don't get discouraged. Don't compare yourself to others in a very detailed, just more of a gross or like macro idea. But this is very individual. Okay, so what happens in the first few days? A lot of things happen. Okay, in the first few days, you see collagen, fibrin. The types of collagen change depending on the staging of the healing and the days, especially that first week, and the strength of the wound changes. Okay, that's why when we're talking about mommy makeovers, breast procedures, the first 2 weeks are the most important ones because that strength on the scar is still very weak. Okay, so on breast procedures, on tummy tucks, we're going to ask you to first, on breast procedures, to keep your arms close to your body, T-Rex arms. That's going to avoid extra tension on the breast incisions. Because those first 2 weeks, that collagen, that fibrin, all those proteins and cells working to heal are still very immature. And any tension is going to cause break or opening of the wounds, okay? Tummy tuck incisions for the first 2 weeks, you're going to be walking bent over, okay? You're going to be sleeping flexed, not flat. All of those things are important to try to keep the incisions together for that healing process to continue, the strength of the scar to get better, okay? But that doesn't mean that at 2 weeks you're healed. It means that the strength of the wound, it's better, okay? But it's still healing. And you can see it's still healing at least at a very high rate for the first 6 weeks, okay? So for 6 weeks, you're going to try to avoid any heavy lifting more than 10 pounds, no strenuous activity, no strenuous exercise, no sexual intercourse, all of those things that are going to increase your heart rate, put strain on the surgical wound, and affect your healing rate and inflammation, okay? So let's go back to the trusting the process part, okay? Why is it important? Because, like I said, healing increases, such as swelling. All of the things that our body produces to heal your wounds also cause inflammation, swelling, fluid buildup, okay? So all of these things are going to cause your results to be different, okay? And let's talk about a little bit of a skin retraction, okay? Skin retraction in both ways, right? Both ways means there are some areas with liposuction, for example, that I want the skin to tighten. And other areas like the fat transfer, implant placement, that I want the skin to settle or kind of release the tension, okay? So the skin ability to stretch and collapse takes time. It doesn't happen right away, okay? So it's the same healing process. For the skin to tighten and bounce back takes weeks, even months, okay? So that's why this 3-month mark that we say to wait for the final results is because of all this healing process taking care. Something or the skin laxity that you saw in the first week, you'll see completely different at a few weeks later and very different at 3 months surgery. So to predict if that skin is going to contract all the way, if you're going to need a tummy tuck at 2 weeks, it's too early. Nobody knows. The answer to that question, nobody knows. You just have to wait. Be patient. Wait, because that skin may contract. That skin fold may go away, but it just needs time. It may not, and you may need another surgery to get rid of that excess skin. Yes, maybe that's also the answer to it. But the real answer to it is nobody really knows until we give your body time to heal. Same thing with the skin stretching part. When we inject fat in the buttock, when we put implants on the breast, everything looks kind of tight because the skin needs time to kind of adjust and settle and get the space that it needs to get that extra fat or that implant, that volume there settle in, okay? So at first it may look tight, high, even small because it looks like kind of tight. Once that settles in, it's not that the volume is going to increase, but by settling, the shape is going to change. So the volume is going to look different, okay? And that is something that it's hard to kind of understand and predict. But again, the trusted process part kicks in, and we just have to give it time for your body to kind of go through those changes, have the swelling and the skin tightening in one area occur, the skin settling and stretching in the other to see a final result, okay? And then this takes me to another thing that Dr. Earl talks a lot about, and I think it's an extremely important topic to discuss, is the physical and emotional roller coaster that all the patients go through after surgery, okay? The physical roller coaster, I kind of explain it a little bit by talking about healing time, swelling, and skin retraction and elasticity ability. So all those things are going to change, are going to happen, are going to affect your results. So you're going to go through all of this. And this little curve here tells you a little bit of all of that combined, the nature of healing, the curve of healing. So basically, it starts little and then starts to go up a lot in 2 weeks, 1 month, and then kind of stabilizes by the 3-month mark. By the 3-month mark, then you start feeling a lot better, feeling back to yourself, okay? But it's important to know that healing, it's not that it finishes at 3 months, like you graduated, that's it. No, it's a slow process that lingers, and you might continue to have healing even up to a year after surgery, okay? So especially with tummy tucks, that it's a lot of surgery combined, meaning the skin excision, liposuction, muscle repair. We have a lot of components contouring your abdomen. That healing and that swelling may linger for even up to a year. So don't get discouraged. Don't get nervous if you still are seeing some swelling 3 months post-op. Like I should be done by 3 months. It's not like that. You'll see a final result at 3 months, but still with some swelling may still linger up to a year after surgery, okay? And the other this is the healing curve, and the other one is the emotional one, okay? Going through plastic surgery is an emotional decision involving many things, and I completely understand that. It involves not only an economic decision, but also family members support, emotional support that you'll need, also physical support. You need someone with you to have the surgery to help you recover. If you have kids, you need people to help you out with your kids. You're also there's a lot, very common, I hear from my patients, I feel guilty because I'm doing this for myself, but also I'm taking out time from my kids or money that I should be using for this and that. And all of those emotions take into place, and I completely understand. I don't want you to feel guilty if you're doing something for yourself, because this is something that most of my patients have thought for years. And feeling better and doing this for you is going to help you be a better mom, be a better wife, be a better human, and be a better person, because you are going to feel better about yourself. But this emotional roller coaster starts even before the surgery, okay? All of those decisions, going through and making the decision and just going through with surgery. Once you have the surgery, it doesn't end up there, okay? Emotional roller coaster continues. And those first few days after surgery, you're kind of like bummed, you're zombied out, you're still on the effect of the anesthesia, pain medications, kind of recovering from that. After those first few days, starting in the first few weeks, you start to get very anxious, okay? You start seeing the irritation, the swelling. This is not what I was looking for. I wanted my waist to be smaller. I wanted my breast to be bigger. I invested all this money. I don't feel like I had the results that I want to. And that starts to kick in. Also, I see that I may have some wound healing problems, a seroma fluid buildup, and all of that starts to build up in you. Up to 6 weeks, then is usually at 6-week mark, once that you start feeling a little bit in your down, because the swelling has improved a little bit, but it's still there. You've been dealing with your post-op course for 6 weeks already, and you feel this is not ending, that something else is kind of like popping up, changing. You see all of this, you start to get impatient. Start to see, I'm not getting there. I'm not seeing myself getting to the place that I wanted. And then after that, it's when you start feeling a little bit better, okay? It gets better. And this emotional roller coaster is like a roller coaster. It's not like goes like this or this. It goes up and down, okay? So you may have days that you're better, may have days that it's a little bit worse. The light, it is at the end of the tunnel. Most of the patients see the little light at the end when they see their final result at 3 months, okay? So this roller coaster is not something for me. Like, I don't want you guys to feel discouraged. I want you guys to be informed that this is something that most of the patients go through. Everybody experiences. We understand that you're going to go through that, so we try to give you the tools that you need to get through it. And it's important that you understand that this is part of the process. So when you're through it, you understand that you're not alone, that most of the people feel that way, and also that you have the family support that you need, friends, family, someone with you to help you through that process. So you don't feel that you're doing it alone. Okay? And I'll show two slides, one for mommy makeover, one for BBL, which are the most common procedures that I do, and explaining a little bit about what are the changes that you're going to see initially and why do you need to trust the process. Okay, so basically this is mommy makeover. This is her body before. Okay, she was looking to remove the excess skin, tighten her muscles, and also lift her breast and get more upper pole volume or more cleavage. Okay, and you see this are the 5-day pictures. Okay, in the 5-day pictures, it's like, this is very swollen. The belly button doesn't even look in the middle. I don't see that my waist is even thin. On the side view, the implant seems that it's almost in my neck. The nipple seems pointing down. The belly seems to be bloated. It's like, what is going on? It's all normal. It's all swelling. This skin needs to also release on the bottom so the implant can drop. This is all swollen, and you see that at 3 months, all of that swelling went down, the waist went in, the implant dropped, the nipple is pointing up, the belly flattened out. So all of those things that you are looking at the mirror and saying, what is going on? It's all normal. It's part of the process. It's part of the swelling. It will improve. And this concerns, you're not alone. Most people have the same concerns of that swelling in the waist. I don't see my waist in, the implant, all of that. Okay? Let's mention a little bit about the common concerns after a BBL. So we have the pre-op here, front view, back view. She wanted to get rid of that excess fat, thin her waist, add more volume, more hips in the area of the hips and the buttock. Okay, more volume. This is the 5-day. I don't see a waist. I see that this is very swollen. There's still a lot. I don't think you did any lipo down here because it's still very fat. I wanted more curve on the buttock. It's still very tight. All of that. What we talked about, the skin laxity and giving time for the skin. Well, this is her at 3 months. All of that swelling went down. This flattened out. You see how her waist improved, how her hips rounded up here. They look very high and kind of tight on the bottom. And then you can see that beautiful upside down heart shape kind of reshaped after that skin kind of settled in. And you can see on the side view that beautiful curve that here it seemed kind of flat because the skin was very tight. Just had to give time for that skin to kind of really soften and get full with the fat that was transferred. And you can see that beautiful silhouette on the side view, okay? So again, it's very hard because I know you guys get impatient and I understand completely. But all of these changes that you see are normal. And you just have to give it time for your body to heal, settle, and to get your final result. I hope these pictures kind of help you out and make you understand that you're not alone through the process. And then when we say trust the process, there's a reason behind it, okay? I'll take some questions now.
Just a few seconds to the guy have questions.
Yeah.
Yeah. Well, this is Vanessa Mayonesa. He says 11 days post-op, and I have loved my results since day one. My body's changing daily.
Yeah.
And I'm so grateful for you.
Thank you. Thank
Okay,
you.
this This question is
Yeah.
from Niva
Okay.
Solovin, and she asks, do you do fat transfer to the boobies?
So I do not, and I'll explain to you why. Okay. So fat transfer to the breast is a procedure that is getting more popular recently. It's nothing new. It has been done for a lot of years. But basically, how fat transfer works is that we're moving fat from one area to the body to the other, but we're expecting that fat to survive in that new area. Okay. It needs to build up new blood vessels so it gets blood supply and it survives. The buttock and hip area is an area that has a lot of blood vessels. So when we transfer fat from the body to the buttock, the survival rate, or the amount of fat that still gets good blood supply and survives in the buttock, is very high. We're talking about 80 to 70%. In the breast is not as high. So in order for us to see a cup size change, usually you'll need multiple fat grafting procedures to the breast to see a minimum change. We're talking about 1 or 2 cup sizes change. And you need multiple rounds of liposuction fat transfer, liposuction fat transfer. The other reason I don't do it is because when you transfer the fat to the breast, when you transfer fat to anywhere in the body, you can have what it's called fat necrosis. So the fat that it does not survive, so that 10% that it didn't survive, it turns into little balls, cysts that usually in the buttock and hip area, they're very small, you don't feel them. But in the breast, because we all need to do cancer screening after we're 40 with mammograms and ultrasounds, it may seem like a mass in a mammogram or ultrasound. And then you end up doing biopsies to these areas because you're not sure if it's cancer, if it's not. And then you're like requiring multiple biopsies for something that it's probably fat necrosis, but you can't really tell from the ultrasound and mammogram, okay? And because implants are so safe and they have great results, I think putting an implant for a breast augmentation, it's a safer, easier, and more straightforward procedure than multiple rounds of fat grafting.
So this question is from the social media guy. So the fat is alive?
The fat is alive, of course. Yes, the fat is part of our body. The muscle is alive, the fat is alive. If we don't have fat alive, then it's fat necrosis and we end up with complications of cyst, infection even. Okay, so yes, the fat is alive.
Okay, dear, this is Marisol, R85. She asked, I'm dealing with everything you're talking about and I'm just 3 weeks post-op.
Marisol, it gets better, okay? So it's normal. You're not alone. It's part of the process. You have to trust the process and know that it'll get better, that it's light at the end of the tunnel.
Okay, how many years you can have the breast implants?
So there's not a limit on how many years you can have them. Earlier, or people that had implants before used to say that every 10 years you need to change them. That is not the reality anymore. The implants are not lifelong devices, so it doesn't mean that the implant is going to last forever, but there's not an expiration date. It doesn't need to be removed or changed in an X or Y amount of time, okay? The only reason to change an implant is if you're having any problems with the implant. What are problems with the implant in the long run? Capsular contracture, rupture of the implant, or the most common reason for have implants exchange or another procedure in the breast is aging of the breast tissue. You have droopiness again. You want to change the volume, change the size, change the shape because your age changed and your priorities changed.
So, Tom, this is from Imperfectly Complete, and she asks if you will see previous fibrosis after ATT. I assume it's a tummy tuck.
Yes. So if you can see fibrosis after a tummy tuck, okay. I mean, yes. The answer is fibrosis is basically scar tissue. Okay. So after any surgery, you can develop scar tissue. Fibrosis, we usually like to use the term fibrosis specifically for the scar tissue that forms after liposuction. The reason for it is because it's a scar tissue that it's basically diffuse, because like the liposuction, you're kind of doing in all the subcutaneous spleen in a big area. So fibrosis is that scar tissue forming in the subcutaneous level in a big area, usually the trunk, where you do a lipo 360. After a tummy tuck, you can have fibrosis, but usually it's more in the areas of liposuction. Scar tissue that forms after a tummy tuck is more closely related to the incision itself. Or if you had liposuction with the tummy tuck, then yeah, you can have fibrosis. That's why I do recommend doing massages after tummy tucks. The first 2 weeks, they're going to be focused on the areas of liposuction, not on the incision itself. At 2 weeks, once, like we talked, once that curve of healing kind of settle in and the strength of the wound is a little bit stronger, then you can start massaging the incision 2 weeks post-op.
Okay, this message is from Pretty.Dila. She's from Puerto Rico. She say hi from Puerto Rico, and also she say that she can't wait for her surgery.
Awesome! You're coming from Puerto Rico. That's amazing. So hi, Dila. I'm also very excited to meet you, and it's a small jump from the island to here, so looking forward to it.
And the last question, but not the least, is what implant is the best?
What implant is the best? That's a very broad question. I have a live that I talk about breast implants, and I talk about the different types, basically saline versus silicone, the different profiles, the different sizes, how to choose an implant. So like you'll get all those details if you go to my Instagram or my YouTube page, and you can find like the one that says how to choose an implant, and I'll go really into details. But usually I recommend to my patients using silicone implants because the gummy bear type, because they feel soft, they feel natural, and they're very safe. That's it, guys. Thank you so much for joining. I hope this helped understand a little bit about why we say trust the process, why it takes time for everything to settle and to see a final result, and to understand that for all my patients that are going through it, you're not alone, okay? This is something that it happens to most of my patients in the post-op period. And also, very, very important, you're not alone. You can always call us, messages through Clara. We'll answer your questions. We'll guide you through that process so you don't feel discouraged or alone in it, okay? And hope this before and after pictures showed you a little bit about the light that's at the end of the tunnel, okay? Thank you so much for joining. I'll see you next week in Tuesday Tips with Dr. Vidal.